We are going to start our lecture on cardiovascular emergencies, and this is going to be part one for you guys, but I may be able to cover more than just part one for this lecture. So cardiovascular emergencies. So what is going to be the goal of this lecture? I'm going to explain basically the information you need to know to essentially pass your EMT-B certification exams, right? And what you need to know for the field of care. So what's important for you to do once you're in the field, actually practicing, right? So some of the objectives that we'll discuss, right? We're going to review the composition of blood as it pertains to the cardiac chapter. Especially, we're going to talk about red blood cells. We're going to talk about platelets, right? When they make the, platelet plug. We're going to talk about anatomy and physiology of the cardiovascular system. Very important. We're going to go through how the blood flows through the heart and how it goes to the lungs, how it goes to the body. It's very important to know all the valves, right? I will take my time to go through it. And it's very important to know all the major arteries of the cardiovascular system. We're also going to talk about the pathophysiology of the ischemic heart disease, right? What's going on there. We're also going to talk about ACS. ACS is acute coronary syndromes. This is just an abbreviation. We're going to talk about patient assessment, EMT patient assessment and management. How are you going to treat these patients? We're also going to talk about pharmacological treatments and the New York State cardiac-related protocols regarding to that. In your skills, right, you guys probably practiced, giving aspirin or assisting with nitroglycerin. So all those medications will be pertinent for this lecture, right? In addition, we're going to talk about cardiogenic shock, right? What is cardiogenic shock and what's congestive heart failure? We're also going to talk about right versus left congestive heart failure and the differences that the patient presentation may have, and also in terms of your patient assessment, how to assess for right versus left congestive heart failure. We're also going to talk about aortic dissection. What is aortic dissection? What is a hypertensive crisis? Hypertensive means high blood pressure, right? Hyper means high, tensive, you're constricted, so high blood pressure emergency. We're also going to talk about cardiac arrest management, and also we're going to talk about ROSC. What is ROSC? Is return of spontaneous circulation. When I did the AHA BLS class with some of you guys, we talked about return of circulation when you get pulses back, and we're going to talk about what are you going to do once your patient comes back with pulses. How are you going to manage them in the field? Right. So let's start with the first part. Right. So if you come to the hospital, right, and I take your blood sample and I put it in this test tube, right, you will see, right, we have red blood cells make up about 45% of this buffy coat, right? And we also have the plasma. So what I want to focus your attention is two things. First of all, we're going to talk about platelets, right? So platelets, you see, they are here, right? And what's so special about platelets? So platelets are found in your blood, and what they do is they cause a plug to form. Now, if you sustain a trauma, right, let's say you got a cut on your hand and you're bleeding excessively, yeah, of course I want the platelets to come and plug up the hole. That makes sense, right? That blocks excess blood of leaving. It stops me from going into further shock, right? Because I don't want to lose all my blood. However, we're going to learn in cardiovascular emergencies where this platelet plugging, even though your body does it to protect you, may be harmful in the long run, right? So platelets are found in your blood, they're circulating, and when they find that there's a breakage in the vessel wall, they're going to come adhere to it to form a platelet plug, right? To stop blood from leaving, and that's what their function is. The other important cell in your blood is red blood cells, right? So red blood cells are found here. So what's the function of red blood cells? So red blood cells, they're bags of hemoglobin, and they predominantly carry oxygen to the tissues. So they, come to in the lungs, they get loaded with oxygen, and then through the circulatory system, which we're going to learn all the valves and all the vessels, they get distributed to your organs, right? So oxygen comes out, and CO2 that's made by your organs is picked up, and this is how we have the exchange of this gases, right? O2 and CO2, right? Now, this is basically how they're made. They're made in the bone marrow, right? We have the stem cells in the bone marrow, and they further subdivide. The myeloid cells form the erythrocytes. Erythrocytes is just another name for red blood cells. And also myeloid cells make the platelets. And these guys here are responsible for the platelet plug that we will talk about extensively during this lecture. Right? This is just a composition of all of it. If I were to break it down, right, what do you see, right? You'll see erythrocytes here. You'll see platelets, right? They make the coat here, and then the what's plasma, right? And plasma, you also have other clotting proteins there, like fibrinogen, that come into play, and you also have electrolytes that are found here in the plasma coat. Sometimes, if you are working interfacility transport, I don't know if you ever get called for abnormal labs, right? They call you, they say we have an emergency code 1 abnormal labs. Usually, what happens when they take blood samples in a nursing home, sometimes the tubes get shaken, aggressively, and what happens? These red blood cells, they break up in that test tube, and so that these electrolytes are now in an abnormal amount. So when they call you for abnormal labs, all that means is basically they probably shook the test tubes when they went to the lab, and they basically need to get another set of blood work done. Usually, patient is not going to have much of a distress, from my experience. That's usually just shaken test tube. That's what occurred. Right. So this is the composition. We talked about that. The next thing we've got to talk about is the distribution of blood at rest. Right. So you notice here we have basically it's a pie chart. We have veins, which make up about 64% here, and then I want to point your attention to the arteries. So when they say large arteries, they usually refer to the aorta, right? So aorta, right? This is the large artery, and only 7%. So, and then the other distribution, right? We have some found in the capillaries. We have some in the heart when it's in diastole, means in a relaxing state. Some of the blood is found in the lungs and some other organs. So, majority of the blood at rest is found in the veins, right? In the veins, and only 7% of the blood is found in your large arteries, which is the aorta, right? Usually, when we talk about veins and arteries, we say arteries are the distribution point, right? So how the blood gets distributed. So arteries are distribution, and veins are the capacitance. It's the storage of blood, right? So where most blood in your body is in the veins, right? This is the same reason why when you, go in a hospital, let's say you were in a motor vehicle collision, you were in shock, and they give you IV fluids, right? IV intravenous, they're giving you fluids in the vein, right? So hopefully to augment that volume, to increase the amount so it circulates, right, in the arteries for the distribution points. Right. So here we have the two systems. We have the venous system, right, the major veins, and we have the major arteries, so the arterial system are here. So the main point that I want to draw your attention to, right, the venous system and the arterial system are not the same thing, right? So as I said, about 64% of your blood is found in the major veins. So 64% of your blood will actually be in the veins, right? All these vessels that you see here in blue, right? This is the venous system, right? All the arteries you see in red, right? And here they compose your major arteries, such as your aorta, and you also have your, peripheral arterial system, how it distributes blood to your periphery, to your all other organs in your body. And we said, roughly speaking, right, the major arteries have about 7% of the blood, and if we go back to this chart, right, some of it is found in the capillary, some of it is found in the heart, very minimal amount, right? So this in the venous system will be the predominant form where your blood is stored. The arteries, as I said, is the distribution point. Now, what's important for you to know, right? So peripheral pulses and central pulses. So when we are actually palpating these pulses, right? Can anyone tell me, are we checking the venous system or are we checking the arterial system when we're palpating these pulses?
Venous system.
Which system?
Already.
Artery system, right? So Carlos, yes. So when we're checking these pulses, we are checking the arterial system. The reason why I say we're checking the arterial, remember I said the arteries are distribution, right? That's what carries the blood throughout the body, right? So the arterial system, the one that you see in red, is what actually carries all the blood to all the organs. So when we are actually palpating the stuff, right, on a patient or during practice, when you're practicing on each other, right, you are palpating the arterial system. The central pulses, right, central pulses being the carotid or the femoral, right, we see here, and the peripheral pulses being brachial, right, radial, posterior tibial, and dorsalis pedis pulses. You probably, when you were doing your splinting, right, when you were placing your splints, right, for radius ulnar or tip fib, you were probably practicing palpating these pulses. So this is the arterial system, and it tells me, right, that the blood is circulating to the distal extremities enough that I could feel, right, I could feel the pulse. You also check, right, we would check CMS, circulation motor sensory. So C, this is the component, the circulation is the pulse. And what also is important, you also want to check the skin, right? If it's warm to the touch, right? If it's the color is pink, I know that there's good distal perfusion. So if the arterial system is functioning properly, I should feel strong pulses right in the periphery, and I should have skin that's pink. I should have skin that's warm, right? Anytime I don't feel the peripheral pulses or the skin is cyanotic, right, or it's pale, or a patient is diaphoretic, right, and it's cool to the touch, I know that the perfusion is poor, right, to the periphery. So then I will check the carotid pulse to make sure at least the central circulation is intact, right? When you were doing your trauma assessment, right, if you checked your radial and the instructor said no radial pulse, you right away check the carotid pulse, right, to confirm that the central pulses are present. I have a question. What do you do if you check the peripheral pulse? Let's say you check the radial pulse, there's no pulse, and then you check the central pulse, the carotid pulse, right, and you don't feel a pulse. What are you going to do then? CPR, excellent, right? Yeah, of course. If there's no central pulses, right, you are going to start CPR. That means that the heart is not pumping adequately. There's one other pulse that's not shown here, right? And that pulse is called apical pulse. And the way you assess that, if you take your stethoscope, right, and you put on the left-hand side where your heart is, mid-clavicular line, right, fifth intercostal space, you take your stethoscope, right, and you just put it there and you put it in your ears and you listen, you will hear apical pulse. That pulse, apical pulse, is very good to assess, especially in infants. Sometimes in infants, we teach you, right, to check the brachial pulses, but you may not always feel it. So just take your stethoscope, put it on the heart, right, mid-clavicular line, fifth intercostal space, and just use your, watch, right, with the seconds hand, and just count for a minute. You should be able to get your apical pulse. That will be the most accurate because it's directly coming from the heart, right? So, or sometimes you may have patients who have very, very low heart rates, right? They may be in states of shock, or they may be overdosed on certain medications, or they may have a heart issue. So if you cannot feel the radial pulse and the carotid, you're not really sure, right, what's the number, just take your stethoscope and place it on the heart and then count it. That will give you direct access to it. Okay. So now this, what I was referring to, right? We really need to know the flow of blood through your heart and through your systemic and pulmonary circuit, right? I'm going to actually draw it out for you so that you are very well versed with it. You're very much familiar with it. So on this diagram, right, we see the major points, right? So we have the inferior vena cava here, and here you have the superior vena cava. So these are your major veins, and they drain into the right atrium. So the blood comes in from your body, right, below and above from the superior vena cava, inferior vena cava, the major veins, and it goes into the right atrium. From the right atrium, it goes into right ventricle. But before it can come to the right ventricle, it has to bypass a valve, right? This valve we call the tricuspid, right? Because there's three cusps, right? So the tricuspid valve is found between the right atria and the right ventricle. And the flow of blood, right, as we said, comes from the superior vena cava, inferior vena cava, comes to the right atrium, and then it flows to the right ventricle. Once the blood is in the right ventricle, now it has to go to the lungs. It has to go to the lungs to get oxygenated, right? So as it comes to the lungs, it has to bypass another valve that you see here. That valve is called the pulmonic valve, right? So the pulmonic valve is from the right ventricle, right, goes to the pulmonary artery, and here we see that valve. This blood that's coming through all these systems so far is deoxygenated. So there's less oxygen in this blood. Now, as it goes through to the pulmonary artery, it now goes to your lungs. So the lungs, I'm going to draw them kind of small here for now, right? So it goes into the lungs, the blood gets oxygenated, right? It picks up oxygen, gets rid of CO2 from the tissues. And once, right, this deoxygenated blood is now oxygenated in the lungs, it comes back to the pulmonary vein, right? So pulmonary vein, both sides, and now it ends up in the left atrium, right? Left atrium. So now we have oxygenated blood that's picked up all the oxygen. It's coming into the left atrium, and the valve that separates, right, the left atrium and the left ventricle is called the mitral valve, right? Another name for it is the bicuspid valve, right? So we see it here. From the left ventricle, once it contracts, it's going to propel the blood through here, right? This is your major artery, which is the aorta. And for it to do so, it has to pass through these big valve called the aortic valve. And then this blood is moved to the entire body, right? To all your organs, to your muscles, right? To the head, for essentially provide nutrients and the circulation component of it. Now, what I'm going to do is I'm going to draw it out for you so that you guys are familiar with the system. I want you to be experts in this, right? I'm going to make it, I'm going to make two hearts. So it's going to be a schematic drawing, right? And we're going to start here, right? So here, we're going to say this portion of this vessel, this is called the aorta, right? This is the aorta. And we're going to say this part, let me take a different color. This will be your left atria. And this is going to be your left ventricle. Now, we are going to add some valves here. Let me use a different color. Right? We're going to add some valves here. So we know the valve that separates the left atria and the left ventricle. This is going to be our mitral valve. And this we said is the aortic valve. Right? And now I'm going to do is connect the system to the veins and the capillary. So we're going to say here we have the capillary system. And I'm going to get some venous system here. And then the blood is going to go through here. I'm going to draw some lungs. So we have two lungs. And then it's going to come to your left atria. Move this over. All right. So let's now put all the components of the venous system so that you are familiar with them. So this will be your right atria. This will be your right ventricle. This valve here is your tricuspid valve. And this is going to be your pulmonary artery. The valve that's coming here from your right ventricle is the pulmonic valve. And one more thing we need to add here, this is your pulmonary vein. All right, so this is a schematic drawing. I specifically broke up both of your hearts into two separate parts, but you guys know that, right? The heart is uniform. It's not two separate organs. It's one heart. But what's important here, I want to give you a schematic understanding so that when you are being examined for your tests, for your state exam, and also when you're doing your patient assessment, so you understand the cardiovascular system. So let's start with superior and inferior vena cava, right? So I was saying from the bottom of the body, right, from your legs, we have the inferior, right, inferior vena cava. So sometimes it will be abbreviated as IVC. So inferior vena cava is this portion here. Superior vena cava will be this portion, and that's your jugular veins that drain here, right? And let me just draw some organs so that you see. Let's say this is your liver, right? Perhaps we'll do a muscle. Let's do a muscle. So here we have a muscle. Could be a biceps, right, or your triceps. You could do a kidney, right? Pretty much any organ. Let me do a kidney. The kidney, where you make your urine. So all these organs, right, that you see in the peripheral tissue, right? So we have blood that's deoxygenated, and we find that blood in the inferior vena cava and superior vena cava. So we start with, we're going to make it blue, right? And we said about 64% of the blood is found in the venous system because they're capacitance vessels. Think of them as like tanks that hold the blood. So this deoxygenated blood, right, that drains from your jugular veins, from your brain, right, from your legs in the inferior vena cava, right? All of that blood is now flowing, and all of it comes to the right atria, right? So all it pulls into the right atria. The right atria, right, now has all the deoxygenated blood coming from your bottom portion of your body, the top portion of your body, coming together. It has to go to the right ventricle, right, because it has to make its way to the lungs to get oxygenated. Before it can pass to the right ventricle, we have this valve called the tricuspid valve. So the tricuspid valve has three cusps, and it separates the right atria from the right ventricle. So the blood first has to drain to the right ventricle, right, before it can get to the lungs. Once the right ventricle contracts, right, it overcomes pressure in the pulmonic valve, and this pulmonic valve is found between the right ventricle and the pulmonary artery. So as this right ventricle contracts, it will squeeze the blood into pulmonary circuit, into the pulmonary artery, right? And it has to have enough pressure that it opens the pulmonary valve so that the blood can now eject. Okay, so my question was, right, if you have blood that's coming from the right atria, went to the right ventricle, and it's now flowing to the pulmonary artery, is this blood that's flowing currently, is it deoxygenated or it's oxygenated?
Deoxygenated.
Deoxygenated, very good, right? So yeah, it's deoxygenated, and the point of this, right? It needs to pick up oxygen as it flows through the pulmonary system through the lungs, right? Because as you guys know, right, we breathe in oxygen through the atmosphere, right? So let's say this is your trachea, right? So oxygen is coming in through the atmosphere, and the oxygen has to load here, right? So this red blood cell, right, that's now coming here, we're gonna say this is your red blood cell that's coming here. It has to get the oxygen. Oxygen has to come and load onto this red blood cell, and this red blood cell will get rid of its CO2, right, that it picked up in the tissues. So now that this red blood cell receives its oxygen supply in the pulmonary capillaries, so these are the capillaries, now the red blood cell is oxygenated, and it's making its way to the left side of the heart, right? So now it's flowing through this pulmonary vein, which you need to be cognizant, and you want to write in your notes. That's a very testable point, and it's a big distinction. Pulmonary artery carries the deoxygenated blood, and the pulmonary vein carries oxygenated blood. I know you are taught, right? Veins usually have the deoxygenated, but this is the distinction here that you need to be familiar. So just to repeat it again, pulmonary artery carries deoxygenated blood, and pulmonary vein has the oxygenated blood that's now it's carrying to the left atria, right? So as this red blood cells are now flowing, right, they now come into the left atria through the pulmonary veins, and now they're going to flow to the left ventricle. Before they can go to the left ventricle, there's a valve there called the mitral valve, or another name is bicuspid valve, right? Bicuspid valve, mitral valve, it's found on the left side. A good way to remember it, remember left side is the mighty side, right? It's the strong side. So mitral on the mighty side. The left side is the mighty side. It's the mitral valve, right? So maybe that way will help you remember. And right, once it's in the left ventricle, right, I should have adjust my diagram slightly differently so that it looks more like this. Right. So from the left ventricle, the aortic valve is going to be found here. It's flowing now through the aortic valve to the aorta, and as this red blood cell that's oxygenated is now flowing through the aorta, as you can see, it can make its way to all the organs and all the tissues, right? As the red blood cell comes here, we said that it was high in oxygen content, so all the oxygen will come out to the tissues. It will diffuse through the capillaries, and deliver the oxygen. The CO2, right, the byproducts of metabolism that's made in the organs and the tissues, it will be picked up, right, by the blood and the plasma, right, and it will make its way back, right, and repeat this process all over again, right? Some other important things that you want to be familiar with, right? So the tricuspid valve, and the mitral valve, they're known as AV valves, right? They're known as AV valves. Why are they known as AV valves? Is because they separate the atria from the ventricles. So you see on this diagram here, right? The tricuspid valve was here, right? And the mitral valve was here. So as you see, the top is the atria and the bottom is the ventricles. So the reason why tricuspid valve and the mitral valve, also known as AV valves, is they separate the atria from the ventricles. Now, the pulmonic valve and the aortic valve, right? They're known as a semi-lunar valves of the shape they resemble. And the pulmonic valve and the aortic valve, they lead to different circuits. So the pulmonic valve leads to the pulmonary circuit, right, in your lungs, and the aortic valve leads to systemic circuit. That's the blood flow to your organs in your entire body, basically, right? So this is what you want to be very much cognizant of. Now, we'll get to this a bit later, but you guys can answer. I'm going to see if you guys understood my diagram. I'm going to ask you a couple of questions. Now, imagine you have a person, right, who sustained, let's say, a major heart attack, right, to his left ventricle. We're going to say the left ventricle is no longer functioning properly. It's now weak. It doesn't contract as strong, right? So the blood is pulling and the blood is backing up, right? So if the left ventricle is not contracting as strongly, right, it cannot propel blood to the aorta. Where do you think the blood will back up into based on this diagram? You typing in the chat, yes, the lungs is correct, right? So if the left ventricle is failing, right, and the blood is not being pushed forward, the backup is going to be here, 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 and the lungs. And that's why when you auscultate the lungs, you may hear pulmonary edema, right? So good. Left-sided heart failure, right, usually will manifest as edema or pulmonary edema in the lungs, right? So you'll see congestion in the lungs. Now, let's say we take another patient and his left ventricle is working fine and contracting good, but he had an injury on his right side. The right side is now not functioning, right? The right side, let's say, had a heart attack and it's not pumping blood into the lungs wall. So where do you think this blood will back up?
Back to the body, to the extremities.
Good, right? Excellent, right? So back to the body, right? So you will see, right? If you look at the legs, the extremities, you may see edema, but also, right? If these were jugular veins, you may see jugular venous distension, JVD, right? Remember how we check for jugular venous distension? You look, right, when the person is at about 45, 90 degree angle, they may have distension of these jugular veins, and they may occur because the person has, let's say, some sort of issue with the right side of the heart. It's not clearing it well, right? And you will see jugular venous distension. You may see edema, right, in the lungs and the periphery. You may see actually what's known as hepatojugular reflex. If you press on the liver, right, you may see engorgement of the veins. Why? Because all the blood is backing up, right, in this inferior superior vena cava, and we see this edema formation, jugular venous distension, right, and all those signs. So it's very important to understand, right, the normal anatomy, right, how the blood flows, and then when there is an injury to the specific part of the heart, right, how it affects the person, right? So just to reiterate, left ventricular failure, right, if you have any injury to the left side of the heart, anything here, and the heart is not contracting, it's not pushing blood forward, right, to the systemic circuit through the aortic valve, the blood will back up into the lungs, and that's what you will hear, acute pulmonary edema, for example, developing. On the other hand, if a person has developed right ventricular failure, right, you will see signs and symptoms such as jugular venous distension, right? You will see swelling on the arms, legs, which we call edema, right, peripheral edema. Sometimes they will call it dependent edema, dependent on gravity, right? So depending on how the person spends their time. So if I'm, let's say, sitting on the chair, right, the blood is going to probably pull in my ankles and my lower back, right? If I lay down, you may have a little bit more equal distribution of it, right? So that's the major things here. There was a Flemish anatomist. His name was Andreas Vesalius, right? When he was basically looking at the anatomy, especially of the heart, he said that the reason why they call it the mitral valve, you notice that the head, right, of the Pope, how the shape of it is. So the reason why they call it the mitral valve is because the head is called the mitri, right, mitri, and the mitral valve, right, is kind of shape of the head. So this is where that name came about. But another name you may see in the book, it's called the mitral valve, is the bicuspid valve, right? So bicuspid valve is another name that you'll see, but this is where the name originated from, right? So mitral valve, yeah, it's the cardinal's head. We talked about the blood flow. A good mnemonic to remember, right, is tissue paper myacids, right? So what is this tissue paper myacid? So this refers to the tricuspid valve, then it goes to the pulmonic valve, then it goes to the mitral valve, then it goes to the aortic valve. So these are the valves in your heart, how the blood flows, right, from the inferior and superior vena cava all the way through the aorta. So if you want to remember your mnemonics, right? Remember tissue, paper, my assets, right? So it goes, right? So tissue, T, tricuspid, paper, pulmonic, right? Then we're going to go through the mitral, and then we're going to exit through the aortic, and then we're going to go through the tissues, right? So the valves that you must be familiar with that are found in your heart is the tricuspid, pulmonic, mitral, and the aortic, right? Any questions about flow of the blood through the body, name of the valves, or anything that I talked about so far? This information that I'm presenting you right now will be extremely, extremely important for you to learn, both for your exams, for your final exam, for your state exam, and certainly if you continue on to, let's say become paramedics, nurses, doctors, PAs, and any other profession, you definitely need to master the blood flow. So any questions, or everything's clear? Okay, so no questions. We're gonna continue, right?